Hello and welcome to Health Show with Amara from our London studios. I'm Dr. Amara Sohail. Today, I'm delighted to host a very special guest visiting UK from Pakistan, Professor Muhammad Umar, who is the Vice Chancellor of Rawalpindi Medical University. There is a long profile of Professor Umar, but I can just briefly tell you that Professor Umar was awarded the most prestigious civil award, Sitara-e-Imtiaz, by Government of Pakistan for recognition of his contribution to the healthcare in Pakistan. Let's welcome Professor Muhammad Umar. Thank you very much, Professor Umar, for honoring us with your presence in our studios today. I understand you are on a study tour and you have visited a few UK universities, and that is regarding your plans to have collaboration with UK universities. So before we talk about your vision for Rawalpindi Medical University, our viewers would like to know about your personal journey. Where did you start and how did you make to this status?
Bismillah ar-Rahman ar-Rahim. First of all, I'm really thankful to your team for this invitation and giving time to me. That's why I can talk to our alumni and so many people around from Pakistan. The journey starts from a very humble background. I belong to a small village near Sialkot. I was born there, and my grandparents migrated from Kashmir, and they settled there with so many difficulty every refugees have. And my father was brought up in the same village, and then he did his matric in the school where I also did the matric. And in 1952, my father did the matric from the school where he was the topmost student. And after 20 years in 72, I did the from same school and become the topmost student again. So this is how the journey started, and our school was 8 kilometers from our village, and these 8 kilometers we daily have to go by feet and come back. So this is almost 15 to 16 kilometers daily to walk to the school and come back. So usually it starts with the early morning, and it was almost evening in winter when you come back, and then you do some homework and again start to go to schools. And then finally I came to Sialkot as a scholarship holder in my matric result, and there I started in the Murray College Sialkot. And then I did my pre-medical, which is called FSC with distinctions, and got admission and I got the highest scores. I was supposed to go to King Edward Medical College at that time, but some of my friends, which now in the UK, they were there. So I just preferred to come to Rawalpindi Medical University because of them. That was college at that time. And that was the highest score I have at that time. And then
fortunate for, I think, Rawalpindi Medical University with the future that came afterwards, after you joined there, isn't it?
I think both good for university and the college, and good for me also. Yeah. Possibly I have less competition here. But anyway, I did my MBBS with distinction and being the second best graduate, and then did my fellowship in the shortest time of 2 years, and became the first assistant professor in Rawalpindi Medical College at that time, and then associate, and then professor, and then luckily in 2013 I became the principal of the same college where I had whole of my career as an undergraduate.
How does it feel? Because it must be such
exciting.
A proud moment for you,
yeah,
that you graduated
right.
from that institution, and then you became the head of that institution.
And particularly, as I was mentioning my humble background, that I was the first doctor out of about 30-40 villages there. And
wow.
Then this career became the principal and chief of medical college, which was a dream for that time. And not only the principal, but the chief executive, CEO of all the hospital of Rawalpindi.
Wow.
So then I continue after that, and then the new struggle started, because this was never-ending struggle in life with the prayer and support of my parent in particular, and family. And then I got married with my class fellow, Professor Bushra. She's also professor of medicine and gastroenterology.
All right.
And with 2 kids, and both are gastroenterologists now.
All right, so it's a family of gastroenterologists.
Yeah, that's right.
That's fantastic. And with your leadership roles, I mean, of course, to be the principal and then the vice chancellor of a medical institution, it carries a lot of responsibility. Do you manage to still do your clinical work?
Yes, and I'm a clinician, I'm a gastroenterologist,
Yeah.
and we established the first biggest gastroenterology department in the public sector in Pakistan.
Wow.
Even in the private sector, this is the biggest. This was 2011, and we started first intervention gastroenterology in whole of the northern Punjab and even KPK and AJK, and established the first endoscopic ultrasound services in Pindi, because this was only done in either Aga Khan or Lahore and one of the army center. The rest we did it for the first time. And we brought not only, training in Holy Family, but brought the elite of, consultant from King's College University Hospital, from London, from Queen Mary, from the Birmingham University, from Glasgow
And
University.
was it with the support of government as
Yeah.
well, or
No, these
these
this
were your
was-
personal efforts?
It was all personal effort. It was a team effort. Me, my wife, she was also, she's a gastroenterologist, and we work hard to build a team in the Rawalpindi Medical College at time with the principal and with other Rawalians, and started this center purely initially on the donations, and now it is the biggest centers.
Wow.
Now so many people have been trained, and there are, at this point of time, there are 7 female gastroenterologists who are doing the intervention gastroenterology in the same centers, and established the first pre-transplant liver center also. And this was the time in 2015 I was awarded Stara Imtiaz for starting this service in the public sector hospital free of cost.
That was my going to be my next question. That was it for general public or was it private? So it was free of cost. And were there any hurdles from any? There is. I know from Pakistan that whenever you are actually aiming to achieve something like this kind of big goals, there can be hurdles or opposition from your competitors. Did you face any such things during your journey?
Certainly, this is very difficult days, because not only that the public sectors, the political resistances there, competitiveness there, and many people feel threatened in the private sectors, because when you are establishing a state of art, a state of excellence center in the public sector, so there were threats. So threat to maybe the private systems. So even more challenging was the funding, because the equipment was costly, space was not available. But I was very determined, because I thought when you do something for the others, when you do free for particularly the sufferings, the ailing humanity, the patient, so God is always there to help you. Absolutely. So I was a strong faith in that, and finally we'd come up with the largest centers where everything is done free and there is no waiting times. So this is first time it happened that these difficult procedure like pancreatic cancer, it's dealt there. It is the CBD stone. It is the other cancers like CBD ducts cancer. So this is all stenting, and everything was done free.
All right. So, and these centers, they are affiliated with Rawalpindi Medical University.
Yes. This is in the Holy Family Hospital, which is one of the teaching hospital of Rawalpindi Medical University.
And it would be recognized for training?
Yes.
For postgraduate training?
At this point of time, there are about 16 trainees in the gastroenterology department. Some are doing the MD, some are doing the fellowship. And I already mentioned that from this center, where we started this with a lot of difficulty and bringing training experience from America, from Harvard University Hospital, the Beth Israel Hospital, Massachusetts General Hospital, King's College University Hospital. So now there are 7 young consultants who do the same procedure which we started about a decade before. So this is how the productivity has increased. Patients have more facilities now, and even our center now can sustain. Even I'm not around, no seniors around, because so many people have been trained.
That is amazing. So it seems like you have created a big team to support all these services that you have initiated. And I was just intrigued to hear that what you have said, it's impressive, and it is of course time consuming, where you have to raise funds and make sure that the service carries on. How did you manage to have any family time? Because clearly if your children are also following your footsteps, their upbringing was absolutely to high standards, and that's why they were able to achieve it. Did you find time for family?
Let me being honest and straightforward that most of the times given to the children was from my wife.
Right.
So I was doing much of these things. She's doing, she's a clinical gastroenterologist, she's a professor, she do the same procedure, but she always took the children to the new heights. And that's the reason they cleared their USMLE and they did the intervention gastroenterology. My daughter done in the Mayo Clinic, which is the famous gastroenterology clinic in America. And now she's working as assistant professor in Baylor University. My son is associate professor. He done from the Beth Israel Harvard University, and he's also associate professor in Minnesota University.
That's awesome. And your wife doesn't actually rub it in that children are her achievements and you had little contribution? Does she ever mention that, or she's like, she feels proud of you?
Certainly, she mentioned this, and she has all the right.
I think so, yeah, absolutely.
To mention this.
And as I was talking to some of your students or trainees, and one of the things that they feel was something very, very complimentary, that despite all that hard work that brought to you this level of success, you always stayed humble. And even if a student comes to you, even in your private clinic, you would never charge them, and you always made them feel very comfortable. So how do you manage that? Because when people go into private work, they have to look at the money-making business as well and all that. So
I think the ethics and character building is first started at home and with the family. That how your parent brought up you, and what was their consideration in ethics and character building. So this is one, that how we were trained at home. And certainly then the very important thing I learned from America and from UK, that how professional people are here, and how ethical they are, and do the ethical practices and good practices.
But isn't it a part of our religion that ethics comes first before, humanity, ethical responsibilities? But very few people, I mean, I'm sure there are good people as well, but in a big, game where there is a race going on, money-making race, mashallah, I think not only that you as a human being come across like an exemplary person, but I think the whole nation should be very proud of you. So thank you for sharing your personal story with us. Now, as a Vice Chancellor of Rawalpindi Medical University, I was reading that in 2021, RMU was ranked top medical universities by the Impact Times Higher Education, which is an international agency. And in ranking, in medical university ranking, you brought it from 6th grade to 2nd. How do you feel about it?
I feel very good, and it is very exciting time. That the story of Rawalpindi Medical University is like this. It was never the university which was created by planning by the government. I mentioned the alumni, and I feel proud that Dr. Sohail, Dr. Irfan, and many other in UK and USA are alumni of Rawalpindi Medical University. So here was a teamwork, here was the idea which was generated that now this college has completed about 40 years, and in northern part of Pakistan there is no public sector medical university. So our college have all the capabilities, faculty, infrastructure to upgrade to the university. So it was the idea of the Rawalian team. I mean, this is never in the planning of the government. So this is a unique university where the alumni and our team basically requested the government give presentation, evidence that we need to establish a university and upgrade this college to that. So this is a unique story. Otherwise, government usually plan for the university. So this is very close to my heart that I was the part and bit a leader of that team. And finally, this was upgraded in 2017. And in a short span of 4 years, we became the university which is in Punjab has the admission merit of for MBBS class was 6 or 7. It in 3-4 years it became the second university after King Edward with only 0.3 marks behind. Why it happened? It was because of clear policies, our missions, our value, and our vision was that this university must upgrade the medical education, research, and services to the poor patient in our teaching hospital to an international standard, and look after those who are poor and create impact. And one of the mission in our university is a university for good for common, for poor people.
Yeah.
And by doing research, we do not do research just for professional reasons or to have more score in the ranking. We do research to find truth and then contribute into the economy of the country and make it knowledge-based economy, and this lead to the growth, more growth and development, and ultimately a prosperous social change and a society. Yeah. So this is the mission which alhamdulillah ultimately become fulfilled, and because of our new curriculums, which was like a UK modular curriculum, integrated curriculums, research-based, research-oriented, research-intensive work of the Rawalpindi Medical University, and ultimately translating all these innovations into the patient care. We became the top-ranking university.
That is amazing. So before we talk about your vision for Rawalpindi Medical University, let's take a break. So viewers, we'll take a short break, and when we return, we'll be joined by another guest, Mr. Irfan Akhtar, who is a consultant surgeon in UK and a former president and one of the founders of APNE.